A dangerous new drug crisis is evolving in Philadelphia. The culprit is a veterinary sedative called medetomidine. The New York Times reports the crisis is, quote, one that is occasioned not by overdosing on the drug, but by withdrawing from it. And it's spreading around the country. Jan Hoffman is a health reporter for the New York Times who's been covering this story, and she joins us now from Montclair, New Jersey. Good morning, Jan. Help us understand why withdrawals are the most serious side effect of this drug. I've not heard of it before.
When people are withdrawing from this drug, which is a veterinary drug that's given to animals during surgery, their sedation ends, their heart rates skyrocket, their blood pressure skyrockets, they vomit uncontrollably, they have tremors, they hallucinate, and they need to go into the intensive care unit, sometimes for 5 to 7 days.
Why are we seeing such a crisis in Philadelphia? I'm just curious how people are getting their hands on vet drugs and if there are enough resources there to tackle this.
You asked two really good questions. Philadelphia has historically and unfortunately been a sentinel for the nation's drug crisis. When things hit Philadelphia first, it's a warning sign that everybody needs to take note. The vet drugs can be, unfortunately, easily gotten on the internet, and they are used to adulterate the current supply of fentanyl. So users are buying fentanyl thinking that's what they're getting, and it is actually mixed with medetomidine. Medetomidine is not the drug they're seeking. They hate it. But unfortunately, they are now even more fiercely addicted to what they're buying because of the medetomidine in it. The resources in Philadelphia, as perhaps other hospitals are seeing in other parts of the country, are beginning to be stretched. ICU units are being crowded with people in withdrawal. Emergency medical technicians are racing to get people to hospitals. And there is going to be, particularly in the winter, a severe problem with people being sedated heavily on the sidewalks, passed out where they are. And the question is, should they be rushed to a hospital? Can they be taken to a warming shelter? How can we best care for these people who are completely unconscious when they're discovered?
Such an alarming scenario that you're outlining here. Just in our last few seconds, what is being done to tackle this?
Well, that's also a good and a painful question. It took Philadelphia some time to figure out what the heck this new drug is. It's not on a standard toxicology panel. But in the meantime, there are medetomidine test strips that are available so that people in other parts of the country can test their drugs. At this point in Philadelphia, this is really a horrible thing to say, but there's almost no point testing the drug to see if medetomidine is in it, in your supply, because it's presumed it's in it. So people in states where it's beginning to be shown, in other parts of Pennsylvania, in Maryland, in Colorado, in Florida,
Yeah.
and even further throughout the Midwest, can test their drug supply to see if it's coming to their area.
Well, Jan Hoffman, we appreciate your reporting and for highlighting this issue for us and our viewers. Thanks for being with us today.
Thank you for highlighting this terrible drug. I appreciate what you're doing.